Hello, my name is Nicholas. I'm going to be talking to you about gender-based medicine and physical therapy. So the first thing we need to understand is the difference between sex and gender. Sex is more related towards the biological characteristics and the anatomy, which is the genitalia and the internal organs. A couple other things to help distinguish between a male and a female is the chromosomes, which is the double X and the XY chromosomes, and the hormones, which is the testosterone and estrogen. Another thing that we need to be aware of is gender is different than sex in the way that people identify as themselves or how they feel. So what also is going to affect their gender is their behavior and their lifestyle. So taking all this into account, we need to understand how they will behave in physical therapy. So as therapists, we already know that men and women behave different, and one way that really stands out is the masculinity of man, and the way the males will deny or delay therapy, and the way they perform in therapy. So by denying or delaying therapy, they could potentially make things worse and have to go through a longer rehab process or more surgical interventions. And with the performance in therapy, men are more likely to try to not speak up towards pain and push through it, potentially jeopardizing form during exercise and just going beyond pain tolerance that they want to be in. And so the women are more likely to speak up, seek medical attention, and do what they need to do to get it done right, okay? So another thing to talk about is pain in general. So what we hear a lot is that women have a higher pain tolerance. That's very common that we hear in therapy, and you'll definitely hear older therapists talk about that, how that's frequently the situation. But research now is starting to show that men actually have a higher pain threshold as well as a higher pain tolerance. Now, pain is a very tricky research topic because it's such a complex issue. It's really hard to get it very accurate. But with a lot of the questionnaires that's coming out, that's the outcome that's happening, is that men are having a higher pain tolerance. But it also varies due to the socialization of gender on how a male and a female will tolerate pain in general. Another thing to talk about is the complexities of gender identity. So one thing is the transitioning from a male to female or female to male. You know, with the hormone therapy, it could bring on side effects that could change the way we need to approach things in physical therapy as therapists. So one thing is they're more prone to bruising and cuts. So if we're doing strengthening exercises or we're doing manual work, then we need to understand that they could be a situation where they get more bruising and stuff, so we need to understand that. Pain and temperature changes, obviously, that could be very bad as far as the temperature gets too high, if they can't handle the amount of pain that they're going through. So just taking that into account and how we do our exercises, and we can modify as we feel we need to. Emotional changes, possibility of emotional outbursts. We just need to be sensitive to the possibility that it's going to happen and just do what we can to comfort the patient the best we can. Sweat and odor changes, there's not a lot we can do about that. The best professional thing to do is just to ignore it altogether. Sometimes it happens, but just try to take your mind off of that and just focus on the objective and getting the person back to being healthy again, okay? Strength and muscle mass changes. So think if a male is trying to transition to a female, there's going to be a significant amount of muscle mass loss, and so strength isn't going to be the same. So we need to understand that could play a factor in the parameters we use. If they're not transitioning and they're just identify as a different gender, then we need to know their comfort levels. So in society, this is a new topic. Gender identity, it's a big topic. It's new, so it's still kind of controversial between a lot of people. Not everybody's exposed to this at all times. So just trying to be the best we can to make that person feel comfortable. So there's a chance that the person is uncomfortable around patients and therapists. So how do we handle that? One thing we could do is their privacy. What can we do? We could have a separate room. We could use a different part of the gym. We could go to the other, use a curtain to cover, whatever helps them feel comfortable. And as far as if the therapist preference, what do? We could use a male or a female. What do they want? And we could try to accommodate that as they feel they need to. Also, they're going to be self-conscious. This is like I said, it's a new topic. So not everybody is self-conscious about, they might feel self-conscious about how they identify as a different person. So how do we handle that? well, think about their pronouns. What are we going to use? Are we going to call them he, she, him, her? How about we just call them by their name or what they want to be called by? So ask them, give them the opportunity to tell you what they want to be called. Have them involved in the therapy. From then we go into the lack of education in gender-based medicine. So we need to understand that hormone levels affect emotion. So if they're in hormone therapy or if they identify different, we need to understand that their hormone levels aren't going to be the same, so that could affect their aggression. We also need to take into account the menstrual cycle of the female and how they might be acting different, in that period, and we need to know how to respond to that. Another thing is that gender behavior affects biological factors, so obviously stress levels, very stressful situation, environmental toxins, and their nutrition. How is their diet? So these could all play into each other. So, stress levels can affect their diet. Are they eating right? Are they not eating at all? That could also affect their tolerance when they come into therapy. So just being aware of their body language and what they're doing, what they look like, how they tell you if they're eating or not. So we could have them as safe as possible while they're here in our hands, okay? And also we need to understand that pathologies affect males and females different. Certain ones seem to target males and females more. A couple examples, the cardiovascular issues is more specific towards men. Women at a younger age are more prone to strokes and autoimmune diseases. Those are just a couple of examples, but this is where it's showing that, these diseases are more prone towards males and females. So that's obviously something to be more aware of. In physical therapy, though, we are not as worried about that because we are treating the diagnosis that they come specifically, and that's where we're going to target that. And so with gender-based training, a quick research that I did take a look at in the Mayo Clinic campus study is a questionnaire of 271 residents, 54% female, 46% male. Out of all of them, 16% of them stated they have no training in gender-based medicine whatsoever, and 55% say they get occasional training. So that's a large portion of these people that are not getting adequate amounts of training for gender-based medicine. Another thing we looked at was the knowledge. They had a questionnaire as far as their knowledge towards gender-based medicine. 48% answered the questions incorrectly or unsure. That's a very large number, and we need to also try to raise that up in the future. So training is important. Like I said earlier, in physical therapy, the specific pathologies that are prone towards each and how we use medicines is not so much specific towards us. We need to think more about sensitivity training and how we are going to keep them comfortable when they're in our hands. So we also need to think about the adjustments. What are we going to do to accommodate that person if they're identifying as a different gender? So one thing we need to look at is their privacy. Like I stated earlier, how can we make them comfortable the best way possible? Parameters. Are we going to use the lighter weights? Are we going to use higher volumes? What's going to be specific to help them get better? And in this situation, a lot of times versus male or female, we need to be more specific towards that person in general. So everybody's different, and just understanding what that person needs. And also the intensity. Are they having side effects? Are they, not feeling good? Are they very stressed out? That could deal with the intensity. So what I'm going to do now is I'm going to talk about a situation where we're going to be in an outpatient clinic, and I'm going to bring a patient in to help kind of show you a couple different things that we could do. So, Steven, if you don't mind coming in, do you mind that I call you Steven?
It's Stephanie.
Stephanie. I'm sorry about that. My name is Nick. I'm going to be working with you today, Stephanie. So the first thing we're going to do is we're going to be working on that shoulder. How's the shoulder feeling today? You having any pain?
No.
No pain at all? Good, good, good. So is there anything else I should be aware of?
No.
No? Good. Let's get into the exercise. So first thing we want to talk about is how much weight do we want to do? If we're going to do a bent over row to try to target the back muscles, how are we going to do that? Are we just going to jump into a heavy weight? No. Good option is just to, if you don't know what they want, if they're not sure, if we haven't worked with the patient yet, start off light. Work your way up there. Progress. Be safe. So what we'll do, we'll start here and we'll get into doing the exercises. So obviously we have various amounts of weights, various bands that we could do to get the right resistance that they need to target the muscles. So Stephanie's going to start doing the bent over rows, and right here, we need to also think about what are we going to do in this situation. As a therapist, we are usually very hands-on. We're not afraid to touch the person, not afraid to talk to the person, but someone that's identifying different, and maybe they're new to identifying a different gender, so we got to be sensitive to that. Maybe as I'm touching them, they're not being the most comfortable. They're showing body language, facial expressions. They're kind of getting away from your touches. So taking that into account and understand that could affect how they perform. So if you notice a difference in the way they're acting, try to use better verbal cues versus tactile cues. Try to approach that situation the best way possible. So that's just a couple easy things to think about for gender-based medicine, and this is something for outpatient physical therapy. So as PTs and PTAs, we could be more sensitive towards everybody and approach everybody specific rather than male or female or how they identify. Okay, so it's going to be more specific towards each patient, and everybody's going to be different. Thank you guys for your time.